Hi, and welcome to the PIERS Association podcast. We're interviewing Dr. Adam Anderson with Axcess Accident Center. Thanks for joining us today, Doctor.
Thanks for having me, Roxy. It's a pleasure to be here.
Thank you. I'm super excited for you to be involved with the things that we're doing because you guys in your clinic really set the bar high for personal injury excellence.
Well, we appreciate that. We try really hard. We're just really passionate that people get better. I think that's sometimes what's missed, and you're seeing all these new ads on social media about enter these 5 criteria and see how big your settlement is. But really, like your body is your number one asset.
Yeah.
Like, how does your life go without that? Exactly. So you got to have your body functioning well. And I haven't heard yet, there's no good replacement parts. So I haven't heard someone say my knee's performance and I can jump higher now. So let's keep this body as healthy as we can.
Yeah, I don't really want to be categorized as a cyborg.
I don't either.
So can you walk us through how you help your patients navigate the legal side of their PI cases?
Sure. A lot of people, especially in Utah here, they're like, oh, I don't need an attorney. Everyone's being so nice. Everything's, just so good. And there's even insurance companies that are offering people, hey, I'll give you $1,000 today to make sure you're covered and we'll get you all taken care of. And so what we want to do is we want them first to do the proper exam and know how injured they are. Yeah. And make sure that we know what the case is. And then we want to tell them, hey, you should really talk to someone who's an expert in this. I don't think you've been injured in an auto accident multiple times. And if you have, we need to have a different conversation. But there's so many things, just like you want a doctor to diagnose you, not a computer. You want someone who's an expert in that field to guide you through every step of the way. And what's nice is most people are like, I can't afford an attorney. I can't do all the things that come with that. But realistically, we want to guide them into, 1, get all the information you can so you can make the best educated decision. And 2, it costs you nothing to be able to talk to a PI attorney about your case and understand what's going on. And so we try and step them through all that process, explain everything to them so that they feel 100% comfortable having that conversation. Because unfortunately, it's a big component. And what's really nice is when they have an attorney, they don't have to talk to insurance companies anymore. They don't have to worry about filing any paperwork. All they have to worry about is getting better. And at the end of the day, that's our primary goal in our offices is patients should be focused on feeling better, living their extraordinary life, whatever that looks like, and not worry about paperwork, documentation, and how we're going to pay for this thing.
What advice would you have for people before they get in an accident?
Ooh. Well, there's a lot to have advice about before an accident.
It's complex.
And it's funny because, having not been trained in it, I wouldn't have done anything different than most of them, right? So I want the cheapest insurance, so I'll just get the cheapest insurance they offer. But the cheapest insurance doesn't always cover everything. Matter of fact, state minimums were created, I believe, back in the 70s. And if you think a gallon of milk's gone up in price since the 70s, I'm pretty sure some medical treatment's gone up since then. Mm-hmm. And so making sure that they get a policy that covers their needs, using the PIP that's more than just the standard 3,000 so that they're covered. And I would just make sure that, wear your seatbelt, drive safe, be smart, have a dash cam. I mean, there's so many things to talk about to educate someone prior to getting in an accident. But I would say those are the big things.
And then after someone has an accident and they're going to go through all of the things, can you talk a little bit about they need the care for the physical issues, but are there other challenges that happen because someone's been in an accident?
Oh, there's so many other things. And so we had a case where we had a girl that was a nursing student who was a regular patient, and she was a half hour late for her appointment. And I'm not going to lie, I was kind of a jerk. I was a little frustrated because she was late. But she was late because she couldn't remember how to get to our office.
Oh, my.
So she had just been in a very bad accident. She had a tremor. She shouldn't have been driving. She was released from the emergency room and cleared. But her concussion was so bad that she couldn't even remember how to get to an office that she'd been to multiple times. And so one of the nice things about that is we were able to go through an exam, call a parent to actually come drive her to her next appointment because we didn't want her driving and getting in another accident. But there's concussion, There is PTSD, so there's trauma associated with it. That's mental trauma that has people worried when they get behind the wheel of a car, or they don't want to go down the same path, or if they hear squealing tires, they instantly tense up. So there's all those things that are involved as well, and so many more. It's just making sure that the patient is covered on all avenues. A lot of people think, well, it was just a little bump, I could walk away from that. Why are they having problems? But everyone's so unique, so different. Every mechanism of injury is different, and everyone responds differently to that trauma. So we just like to make sure they get everything they need.
So they should get checked out first
100%.
before they tell everyone they're fine.
Yes.
Stop saying that. It's not true.
It's just not. And like I said, thank heavens now we have places like Census, and we have places like there's just a lot of different ones, Concussion Pros, and different people that are out there doing the research and knowing more about concussion than we've ever known. 10 years ago, it was like, we'll wait 7 to 10 days and see if it goes away. But there's so much more to it, and so many more people out there doing what they need to make people really recover and do well. And I'm thankful for them, because I don't do that. That's not my job. I can do all the other stuff, but we need that team to make sure everyone is contributing. There's other sets of eyes, and that the patient's getting everything they need.
So do you think it makes a difference when you're working on specific symptoms that they have, but they have other things that they need a specialist for, and they're not getting that care? How does that affect your ability?
Well, everything's tied together. Unfortunately, we can't separate it. But so if they're not getting all the treatment they need, our recovery goes slower. They get frustrated. They're not maybe showing up for their appointments. They're forgetful. All sorts of different things happen. Or our latest one, she got so nervous. She was hit on a moped in an intersection by an SUV.
Oh.
So to be in a vehicle scared her. So larger gaps in treatment, everything else. And so getting her the psychological component taken care of has allowed her to come to get her physical appointments taken care of and get her body back to where it needs to be. So it affects everything. We really need to work as teams to make sure everyone gets what they need.
What's the likelihood after someone's had a wreck that they're going to have another accident?
Boy, I hope not very likely. But we do have some patients that experience multiples. As a matter of fact, we even have people that haven't even finished their rehabilitation from their first accident before they get in another one. And that makes it challenging. But that's why we love people like Jeff States, who teach us how to do apportionments, how to make everything right. So that Personal Injury Training Institute is amazing. And then we're coming to places like PIERS, where we keep getting more knowledge. And if we can get that education component, then the patients only get better recoveries, better everything. And their number one thing is getting their body back, but the number two thing is making sure it's taken care of. It's not their fault that they got injured. They shouldn't have to pay for this. And so making sure that everything's done well gets them that kind of security that they need to make sure that they're taken care of.
Part of what's going to make PIERS Association successful is members like you guys.
Oh,
because you're doing all the things, and you are being educated and improving your quality of care for your patients. So that's inspirational to others. What would you like to see improve in personal injury in the next 5 to 10 years?
I would just say the education component. A lot of people don't think that they can use their insurance, or their rates will go up and they suffer. And there's just so many myths out there. We'd love to see some myths dispelled about what they should do after an accident. Well, insurance, so many things.
Yeah.
We would love just to see people start to, again, until I started in this field, I didn't know everything I knew.
Yeah.
And I wouldn't have known to do all the things after an accident. But now it's like, we've got to help everyone understand there's resources, there's benefits. They can have their bodies recover. They don't have to pay for it out of pocket.
Yeah.
So many things that are out there. I would just love to see that component come to life, where it's not just everyone's just an ambulance chaser trying to get some money. It's really not about that. This is a very traumatic experience, and people need that opportunity to recover.
And they need a good team.
They do. Absolutely.
Thanks so much for joining us today, Dr. Anderson. I appreciate your participation in PIERS Association.
Oh, thank you so much, Roxy. Appreciate you.
Thank you. Thanks for joining us on the PIERS Association podcast.